Sharing. Okay. What did I do? Shit. Can you see my PowerPoint here?
Yes.
Yes.
Yes. Okay. Make it bigger. Oh, okay, I think we finished with this one, right? Delay hypersensitivity. Am I right?
Not sure.
How about the next time is this one? Transparent rejection. Did we talk about autographing yet? I don't think
Yes.
so, right? Did we? Autographing and allographing.
Let me check it. So you have done 36.
36. But did I talk about
Yes.
36 yet?
I don't think so.
No, huh? Because I don't think so either. Because I feel like, okay, I think that I didn't talk about this. All right. So let's go from the 36 right now. Okay. So I will try to finish a little bit sooner. So that's why you guys can get some rest for tomorrow, your clinical rotation. Okay. So here, transparent rejection. So we do have some kind of like a transparent rejection, and we talk about that a little bit already. So here this slide is talking about the two very important things: is autographing and allographing. Okay. So the meaning is autographing. That means it's actually the patient need graphing. They take another tissue from their own body and just transportation to another part of a body. So for example, so if a patient have like a severe burn, okay, is burning on the body. So that's why that part is a leg of skin. So that's why we can take another part of the skin, maybe from your leg or from your side, and just graphing to cover with that part of skin, just get burned. Okay. Or either way, remember we have a bypass surgery, right? So your heart need another new vessel. So that's why we took another new vessel from your leg and then we graft into your heart. All right. So it means what? Autographing. So the reason we use autographing is because it is kind of like reduce the rejection because it is actually the tissue from the patient, their part of the body. So usually it doesn't get rejection. Yeah, so it's the same DNA. Okay, it's the same, just different tissue. So that's why patient usually the graphing is usually is kind of like over 90%, 95% successful. So not having lots of complication. Is not even have some kind of like rejection. So your nursing intervention is about what? You are gonna have usually have like a two surgery side, okay? So the main one, the damaged one, and we fix it, and also another one is a donor side. So that's why when you're taking care of this patient of the surgical patient, so you need to maintain with these two surgical side, like a nice and clean, infection control free, and also change the dressing and monitor with these two wounds. Okay. Another one is allographing. Allographing it means what? This patient took another tissue from another part, another person. And another person donate to this patient. So the very good example is a bone marrow transplantation. Okay, so when the patient maybe have like a cancer and under the chemo, so that's why they are not able to produce a very good blood cell from their bone marrow. So that's why the patient need a donation from another the normal and good person, their bone marrow. That's why we aspirate the bone marrow and inject back to the patient. So you're gonna have a two patient. Okay, two patient in a different, maybe in a different site. Well, usually it's different site of a surgical intervention. So that's why we have like a patient is receiver and also donor and have like a also surgical site. So autographing and allographing, the very important is that one is just only one patient have like a two surgical site is autographing. Another one allographing is a two patient with a two surgical site. So that's why we're including your nursing intervention. Okay, so isographing, this one you can read by yourself. Usually it's not happen a lot. So issue transfer between like genetically identified people, identified twin. That means what? That means if I have a twin brother or sister, so that's why usually the DNA is much more alike. So similar. So that's why they donate to each other is most likely will reduce the rejection. Okay, but usually you don't find a twin that's very easy, right? So this is isographing. You don't see it a lot during your clinical side. Right, the next one. Okay, so the donor and the participant, the receiver, it need to be like a close match is possible. That means what? So when the donor want to donate their part of body tissue to another receiver, to the patient, so do we also just do like the match and cross? Not just even blood. Is also some kind of DNA testing. So that's why we wish that DNA is much more possible alive. That's why we reduce the rejection. So if we say, okay, we want the DNA much more alive, so that's why you are going to think about it. So usually we will like the donor, maybe it's from the family side. Because the family, usually the DNA is much more alive, right? Does that make sense? Yes, right? But anyway, so after this kind of like a surgery, like a donor and a receiver, usually they have like a surgical site, right? That's why infection is kind of like a big concern, okay? Careful with the aseptic technique, that means a sterile technique. You want to make sure everything is nice and clean, like a surgical technique. Okay, you don't want to just have some kind of like a bacteria infection. And usually, sometimes if we worry about that, so prophylactic and antibiotic is initial. So we can give some antibiotic from the beginning, even before they donate and receive a new organ or grafting. All right. Graphic nursing intervention, okay. So the graft, that side, need to be immobilized. Okay, what does that mean? So that means if I just get another new tissue, like a new skin, and just cover with some kind of like a skin side. So that means what? That part, I don't want that grafting is kind of moving around because it's gonna falling apart, right? Is falling off. So I want the graphene stay there until they can just healing and stick it together with the body tissue. So that's why maybe I need to do some kind of immobilization. It could be by the gauze, or could be by the suture, or that maybe will put some kind of like glue and just sticking together. All right. Another thing is a wound monitoring. Well, it's a wound, so that's why we need to monitor some symptom of infection. Of course, the donor, okay, donate the tissue. That's a donor side care is also very important because they also donate the tissue is also going to be a surgical wound there, okay, clean dressing, and the pain management. So it's going to be pain. So that's why it doesn't matter with the donor or receiver. Even the donor they donate the tissue. So it's a surgical side. That's why we also need to offer both of them the pain medication. All right, patient education, avoid extremity activity because we want to make sure this kind of like a wound and or like we apply the new grafting will be kind of like a new tissue layer. So that's why if you have like extremely activity, sometimes it will falling apart with that tissue, like the skin maybe will falling apart. So this is the reason. That's why I tell the patient, okay, do some mild activity and with covering with the side with a like, nice and good dressing. That's why it's not going to be like falling apart. And the sun protection. So when we just have this kind of the donating side layer, either way the donor side or either way the patient the wound side, the surgical side. So the new skin or the new grafting is growing, so that's why you don't want just exposed to the sun directly. So because of the sun, sometimes the temperature is hot, or either way with the sun ultraviolet. Okay, ultraviolet. will kind of damage in the new wound. So this is the reason that's why we maybe want to cover it. So like a long sleeve dress or like a sun blocker, okay? Usually a sun blocker, we don't really use it that so much because you don't want to put a sun blocker directly on the surgical side, like a donor side or like a wound side. So this is the reason that's why usually we will cover something like a cover with a long sleeve dress. Okay, is that possible? And you can put some lotion and like a fragrance-free and moisturizer on the graft daily to prevent the dryness. Because the graft and maybe like a skin, okay, when they get dry, they get wrinkle and falling apart very easy. So that's why sometimes the doctor will give you some kind of like a medical field use lotion. Okay, why we use a medical field lotion? Why is not normal like a lotion outside? Because sometimes the medical field lotion, you have some kind of like a medication inside, well, antibiotic like medication. So that's why we can just maintain, we don't have a bacteria on the wound. That's so easy. Okay. All right. So this is immune deficiency disorder. That means what? The immune is low. Immune is low. Okay, so that's why the immune system is kind of like inadequate. It's not normal like a normal person. That's why the patient usually cannot fight with the infection. So that's why they get sick very easy. All right, so the evidence is a decrease the resistance of infection. That means like infection very easy. Okay, so that's why you can read of this involved with all the immune mechanism. All right. So the B cell, T cell, you remember, especially the T cell. T cell is the memory cell, okay? Will remember the pathogen like a bacteria or virus. So that's why if a T cell is not function, usually your immune is already low. Why? Because the T cell cannot call your immune system to attack the pathogen like a bacteria or virus. All right. Drug-induced immune suppression. That means what? We actually just get the medication, try to put the immune system low. We do it on purpose. Why? Usually it's to prevent the organ or tissue, like a transplant, rejection. Because we don't want this patient, their autoimmune system attack the new organ. We just give it to them. Okay, we don't want that to happen. So that's why we give this kind of medication, kind of suppress their immune system. So here is also another thing is a serious side effect toxicity of the drug, like a chemotherapy, is also well kind of like a secondary immune system, like a suppression. So that's why we give the medication usually the drug induced. This is happen a lot in the medical field. So that's why we need to monitor. If this medical field causes the problem, we usually need to be like a close monitor. Okay, like a lab draw or constantly like maybe EKG or like a chest X-ray to find out if the patient is sick. All right, so this part you can read by yourself. Immunoglobulin level decrease with the age, right? So that means it's an antibody. Antibody. And the thymus is kind of shrinking and decrease. So that means decrease the T cell number. That means the T cell is not going to be produced and mature again if you grow up. All right. So this one you also can read by yourself. Radiation destroy the lymphocyte. Okay, so will destroy your immune system, like your lymphocyte, also white blood cell. So this is the reason that's why patients under radiation for a while, also like a chemo, immune usually is not good. So that's why it's easy to get an infection. Okay, and you can read this picture by yourself. Okay, here we're going to talk about autoimmune disorder. Okay, so autoimmune disorder, we have lots of things. Is that one thing is we need to remember something about like a vitamin D. Okay, why? Because vitamin D actually can fight some kind of inflammation process. Okay, especially for your upper respiratory system. So that means what? Your trachea. So remember when the COVID-19 was happening, we have a certain group of doctors encouraging you to take a vitamin D, right? Yes, this is the reason. Because the vitamin D actually can helping you, okay, to fight some kind of like inflammation process. That's why patient doesn't have lots of inflammation. Vitamin D also have another the helping is if we do have a osteoporosis, we intake a calcium. Vitamin D will helping the calcium like a synaptic, the kind of like a binding very easy going to your bone. So that means if we just have some vitamin D in our blood and we take a calcium, will be easy to absorb. Vitamin D just kind of like a guider, okay, it's guiding the calcium going back to the bone. So how can we take a vitamin D? So usually it's a dark skin color people or like Asian, Latino, or like Alaska American. We have a better vitamin D, and because our skin under the sun exposure and will kind of like produce the vitamin D a little bit easier. But usually the Caucasian people, the white people, they are not because their skin is white tone. So that's why it's not changing the color. That's why they don't fermentate the vitamin D from their skin very easy. So this is the reason. That's why when you go to the Costco or you go to the pharmacy, you can see they are selling the vitamin D. So that's why we kind of making a joke. Say, okay, vitamin D is for white people because we don't really need that. Only white people will need that because their skin is too pale. So that's why they don't get the 10, they don't get a vitamin D and combine very easy. All right, but here we want to talk about something else. Okay, this is all your autoimmune system disorder. Okay, you can see everything here, even more. I haven't listed even lots of things. Okay, so we are not going to talk about all of this because some kind of like an immune system is linked to other disease. So for example, like a pernicious anemia, this is linked to the blood disorder, and we talk about that already. Okay, the Guillain-Barré syndrome usually is kind of like a virus infection. So it's about like infection process. Also because if you inject some kind of vaccine, will cause this kind of symptom. And the rheumatoid arthritis is musculoskeletal system, and rheumatoid and fever. This is in your cardiac. Okay, and ADs, we talk about that already. But here, NCLEX in the autoimmune system in this chapter, what we like to ask. Okay, you can read the picture by yourself. Is this two? In your textbook, rheumatoid arthritis, we're going to talk about that in your in your musculoskeletal system. Type 1 diabetes, we talk about that already. Psoriasis, we're going to talk about that in the skin system. So here, this one, the lupus, is the one we are focused on. We are talking about that. It's going to be in your final exam. Okay. Everybody heard about lupus, right? Is anybody doesn't know the lupus? You don't hear about this disease before? Did you see the lupus? No. Did you see? Is anybody see the lupus in your clinical rotation? Yeah. Okay. No problem.
I'm not sure.
You're gonna see it if you're working long enough. You're gonna see the lupus patient. Okay. All right. What does it mean lupus? Okay, it's a systemic lupus erythematosus. So we call it SLE. So lupus, we call lupus, or either we call SLE. So it's kind of like a chronic and multi-system autoimmune disease where the immune system attack to the healthy tissue. They come in to attack your own body, cause the inflammation of the joint, skin, and the kidney, and also other organ. It causes with this kind of multiple organ have under attack. If it's severe, it will become like a failure, become like an organ failure. Okay, it's not just only one organ; it will be a multiple organ failure. So that's why this is the reason why we need to give the medication to treat lupus. The reason is this. So because the attack their own body will cause the organ failure. We don't like it. All right. Severe fatigue and joint pain usually is a significant symptom. Okay, they always feel tired. Okay, especially joint pain. Okay, and with the also one. This is the only one thing is very special happen in the lupus. Okay, you need to remember this symptom: butterfly shape facial rash. Butterfly shape facial rash. So it's a kind of a rash or the mark on the face. On the face, it's become like a butterfly-like. Okay, I'm going to show you the picture later. Okay, only lupus have this kind of symptom. So always remember when you see the NCLEX or when you see the patient have this kind of butterfly shape facial rash, is by like bilateral, but both sides of a face. So that's why majority you can say is about like almost like 80 to 90%. This patient is SLE, is lupus patient. Okay. Also, another thing is lupus, the cause, the reason unknown. We don't really know. We know it's an autoimmune system problem, but majority is affecting by the woman. It's affecting to the woman usually. It's high rate. It's got like over 70, 75% to the woman. Men is very less likely, maybe like 15 to 25% only. Usually it's the woman. Okay, it's not to the kids, it's for the adult. So that's why you can see the age is 15 to 44 years old. Okay, it's for the adult. All right, you can see the pictures here. Okay, so it will attack to all your organ. That's why you can see it's the lung, the kidney, and the heart, and also the blood and muscle, the joint. Okay, it's significant is the joint. So you can see the picture here, the face. So you can see it's both face, the both side have some kind of like a very typical rash. Okay, will be covered on like your nose. So it looks like sunburn. It just looks like a sunburn, but it's not a sunburn. Because if it is a sunburn, it's kind of equally on the whole face, right? But it's just not equally on the face, just on the cheek area and nose a little bit, the both cheek area and going to like an upper face and lower face. Okay, so for both picture, you can see it. Okay, and both female. So this is a very typical sign symptom. If I asking you the lupus, a very typical sign symptom, what are you gonna answer me? The butterfly fresh, the butterfly facial rash. Okay, this is very typical butterfly rash. Okay, let's talk about the joint. We talk about many times the joint have lots of pain. Okay, this is a lupus, and we call it like a rheumatoid arthritis. It's kind of rheumatoid arthritis because the autoimmune system attack your own bone and also your muscle. So that's why you can see it's all deformed. So all the joint, the right hand joint, this one is okay. It's still normal a little bit. Just the finger here, the fingertip is twisting. You can see the left side, the left joint. You can see the pinky toe, pinky finger, and also the ring finger is totally twist already. So the joint is destroyed. So that's why the hand is twisting. So in the real life, you can see the left side. Okay, the left side joint. You can see this is the X-ray, and the bottom part is a real person. Their finger. We call this kind of like a swan neck finger, just like a bird. The swan bird. Okay, the swan neck. Okay, finger. It's kind of like a long, but it's twisting. It's twisting. So think about something. How is the patient function with the daily activity? Do you think they can function like a normal daily activity?
No.
No, right? It's not. First, it's very painful, and also second thing is, do you think they can just bend their finger very easy and open their hand very easy? No. So that's why this patient have like a significant big problem is, and they will tell you, okay, I have a hand, but I just cannot use my hand very well. I need lots of help. So that's why your nursing intervention is that you need to do so many things if it's a very handy job and you just use a lot of hand and it's very detailed. Okay, it's very detailed like a handy job. The patient usually cannot do it, and you need to help the patient to do it. Okay, for example, how is the patient eating? Do you think the patient they can eat with the normal knife? They can cutting the food by the knife? No, they can't.
No.
They can't. So that means what? This patient need to eat some kind of they still can chew. The patient doesn't have problem can chew. Okay, they just cannot cut the food very well. So that's why we need to just have like a chopped food for the patient. We chop the food or we cut the food ready for the patient. That's why patient can maybe use the fork. Okay, can spike the food and just eating like this. Okay, that'll be easy for the patient. And for all the normal daily activity, like how about brush the hair? Do you think the patient can hold a comb? Not really, right? So that's why. So usually the patient will asking you, can you just brush my hair for me? Or either way, we have like a special tool. Okay, so that's why I'm gonna introduce you some kind of like a special tool here. So we have lots of very special tools kind of designed for the patient. They have like arthritis. Okay, you can see this is a utensil, the knife and the fork and the spoon here. We put like a bigger size of the handle. The handle here, okay, the handle. So that's why the patient can hold it very easy. It's not kind of because it's too small and then they can pick it up. They cannot pick it up. They can hold it very easy. All right, and open a jar. Okay, did you see this kind of tool? So that's why a patient can easily open a jar by this kind of tool, easy. So that's why they don't use it like a lots of strands, and to open the jar is very difficult, and they have lots of joint pain already. And also this kind of glove. The glove is also the protection, but also the glove will keep the patient the circulation better. So usually when the patient their hand circulation is better, they can move a little bit better. If it's cold, the joint is kind of stiff. So that's why they cannot move their joint very easy. So this is the reason that's why NCLEX is telling you, okay, how can we just maintain the patient if they have a joint arthritis on the hand? So in the morning, we can tell the patient, okay, when you wake up, you can just use the hot water to wash your face, or just brush your teeth with some kind of like warm water, a little bit hot is okay, or just maybe have like a little bit hot shower and with your joint. That's why your stiff joint will be suddenly wake up with a good circulation, or wearing some kind of like good circulation glove. All right, and you see the walker is also some kind of special design. They can use the walker, but the problem is the handle here. We need to put some kind of special like a sponge handle. So make it bigger. That's why they can hold easier. Because they have a hard time, they cannot hold something. That's why we need to put something extra for the patient. So this is the reason in the N class they were going to asking you, how can we just helping the patient with arthritis? Teach them or educate the patient. Use a proper medical device or medical machine. Tell them how to use it and teach them how to use it. That's what can making their life a little bit more easier. Okay, a little bit easier. Okay, let's go back to the topic here. Joint pain and swelling, okay, is very stiff and it's kind of like twitching and it's kind of become deformed. Because skin rash, okay, is a butterfly light, is a skin on the nose and cheek. So if I know the patient has skin rash, and also this is kind of like a trigger, if a lupus people and this patient is triggered by the stress, okay, or by some kind of like outdoor some activity or like a sunlight, will trigger their rash even more severe, or the lupus is going to happen even more easy. So I don't want this patient, the skin, exposed under the light, because it will trigger they have a rash, skin rash. So that's why I will tell the patient, when you go outside doing the outdoor activity, please just cover yourself very well. Just wear the hat or wear the cap, and maybe some kind of like a longer shape of the clothes, okay, and like a longer pant, okay. Wear the shoes. Do not expose your body, your skin part. Not so easy. All right. So for this, and that's why the patient actually is a photosensitivity. The skin rash is getting worse if after exposed to the sunlight. Okay. Do we recommendation the patient use a sunscreen? Yes or no? For this patient, think about it.
No.
Why not?
Yes.
Why yes? Change so fast. Okay. All right. So usually normal situation, we still tell the patient you can use a sun blocker. But in one condition, and we tell the patient, okay, don't use a sun blocker anymore. About what? About if a patient their skin is very sensitive already, it's gonna trigger their rash happen. Then we avoid to use a sun blocker. And remember something is all this kind of sun blocker selling in the pharmacy or selling on the cosmetic, all this brand. Most of the land they put a chemical, right? It's chemical. Have you seen some kind of like a natural sun blocker? It's very cheap. No, that usually is very expensive. I saw some kind of like how you say like organic suntan screen, sun blocker. Okay, oh my god, the small tube is cost like over $40 or $50. That's expensive. So usually the patient they don't want to buy the expensive sun blocker, they buy the cheaper one, so which is lots of chemical inside. So that will trigger the patient to have a skin rash very easy. So this is the reason. That's why we tell the patient, okay, wear like a long sleeve clothes. We can just say, okay, just use a sun blocker. That's not easy, right? Why we do that? Just because the sun blocker is going to trigger the skin rash. Okay, that's why most of the time for this patient, their skin is very sensitive already. For the lupus, we don't recommend them use a sun blocker from the beginning. If they are not sensitivity, they can use yes, but it depends on the patient. Okay, and the kidney. The lupus, okay, is kind of like autoimmune system is going to attack your kidney, will cause the kidney have inflammation. All right, so it's cause the kidney have like a nephritis. So that means the kidneys have some kind of inflammation. It's going to cause kidney failure eventually. So that's why these patients sometimes if the patient will tell you, oh, something kind of like, okay, I have some hard time to pee. So the patient maybe have some kind of urine retention, they don't pee a lot. Or either way, the BUN or creatinine is high after you draw in the blood. So that's like a significant to tell you, okay, kidney has some problem already. So that's why this patient, the lupus patient, they need to go to see the nephrology, the kidney doctor. They need to consult with the kidney doctor a lot. Okay? All right. And the heart and the lung. Okay. Also, they're going to attack to your heart and the lung. So that's why you're going to have some kind of heart inflammation or lung inflammation very easy. So that's why, and sometimes the patient maybe have some kind of like a cardio disease, like a pericarditis. Okay, the lung is a perirosis, means the fluid between the lung lining. So that's why patients sometimes will do the EKG or chest X-ray. We're going to check if their lung and heart is okay. Am I too fast?
It's okay. It's fine.
No.
No, okay.
You're good.
I'm recording. Okay, so that's why going back to the YouTube, and you still can access. Okay, I'm gonna put it on the public right now, so that's why you still can access. Okay, all right. So unfortunately, SLE, the lupus, is no cure. No cure. It's lifelong disease. So that means what? The patient, their management with the lupus is lifelong. So that means what? Until the patient die, they still will have a lupus and maybe still taking the medication. Is no cure. But it could be have a better sign and symptom. Okay, the patient is controlled very well. They not trigger the lupus so long. They could be have so many years like happy time without a lupus attack. Okay, that's why the patient will be showing the patient, okay, taking some medication like NSAID, okay, NSAID, NSAID, anti-inflammation drug, okay, it's for the whole body inflammation, also for the joint pain. Maybe also use some steroid medication is also for the inflammation. Okay, and for the skin, we can hydrochloroquine. And for the skin and joint issue, okay, also immune suppressant. I highlight this one, very important. Lupus patient, so many times, if their sign and symptom is not controlled very well, it becomes severe. Unfortunately, in the end, we have to use this medication. We need to kind of like suppress their immune system. We need to just tell them, okay, their white blood cell or leukocyte do not attack the body. So that's why we have to use this. Again, when we use this medication, what will happen? The risk of infection, because your immune system is going low right now. So that's a patient will get infection very easy. All right. Lifestyle management. Avoid the sun exposed. Okay. So because due to the photosensitivity, okay, that's why wearing like a long sheet of clothes and to cover with you, cover with your skin. Also, adequate rest because they feel tired all the time. And the diet management, okay, smoking cessation, don't smoke, okay, and stress control, okay, because stress is trigger the lupus, okay. Proper daily activity. So, because the activity is extreme activity, also will trigger the lupus happen. But they also need to exercise, right? So that's why we don't tell the patient do not go to the exercise. Extreme exercise, we don't like it. So that's why as a patient, as tolerance, that exercise is okay. All right, it's okay. Lupus patient, I forgot to tell you this one here. Okay, please put it on by yourself. Lupus patient, please do not drink alcohol. Okay. I type it here. You see it? Okay. Lupus patient, please don't drink alcohol because trigger the lupus very easy. Okay, we don't like it, especially when they're taking all this medication, they're drinking the alcohol. Alcohol is going to make this medication not working at all. All right. Some disease they can drink, but some disease they can't. Sorry, lupus patient usually they cannot drink alcohol. And like overstimulate drink, also not recommend. Like coffee, caffeine, okay, high caffeine food, okay, is not recommend. All right, here, encourage you to use the proper equipment like a walker, cane, the jar opener, the pathetic glove, and safety precaution because they have lots of joint pain, and also it happen to their toes, to their feet, and to their knee, and also their hip. So the joint is not stable because the deformers, okay, they attack their joint. So that means what? This patient joint is kind of deformed, so they're walking with the pain. Also, they're walking with a non-stable, not steady gait. So that means they fall very easy. Okay, so that's a safety precaution. Okay, so be careful. This patient will fall very easy. And also, the patient is taking like a steroid NSAID. If they fall, this patient will bleed. So be careful of that. All right. So this is the last slide. And here, so for the patient, and usually when they eat, they need to have some kind of like a special equipment, okay? Because when they cannot pick up the food very easy by the normal spoon and the knife, and they need to be cutting the food for length, okay? So that's why we have this kind of like the dish lid. Okay, it's not a lid. How are we calling this? I haven't seen this in so long, so I suddenly forgot the name. Okay, we're calling this is some kind of like a stopper. The play stopper. Okay, it's stop the food here in the edge, and that's why the patient can pick up the food very easy. Okay, any question?
No.
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 We're good, huh? Okay, sure. So the lupus is kind of autoimmune system disease, okay, and usually it's kind of like a management, no cure, and taking the medication, okay, and then the nursing intervention most likely, and the food, we need to prepare the food for them. Also, the life is very difficult. That's why use the proper medical equipment can be helping them. So that's why they need somebody close to them and taking care of their daily life because they cannot do the function of daily life, like washing the dishes or like doing the laundry. That's very difficult for them, okay? And that's why they also need to be careful of this nursing intervention and the food choose, okay? All right, so if no question, I'm going to stop here. Okay, you guys just get some rest because tomorrow you need to wake up early to your clinical rotation, right?
Thank
Thank you.
you.
Thank
You're
you. Good
welcome.
night.
Good night.
Bye.
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 Wait, let me call
Bye.
attendance. I almost forgot. Let me call attendance first, okay? Wait a second. Let me go get a pen and paper. Okay. Where's the pen? Oh my god. Every time I put a pen here, you took it away. Oh, here. Alright. Let me see who is here. I have Lorena. Okay.
I'm here.
Yes. Lorena. And then Sylvia. And I have Oscar. And the next one, I have Yuriana Garcia. And this one's Maggie. Okay, and this is Alice. And Rosary, okay. And this is Perla. Then Vanessa. And this is Yuan Yuan, okay. Orissa, okay. And this one is April. And Joyce. Bryce. Yana. Okay, that's it, right? Oh, Sue is not here today? Okay. Okay, so You guys can dismiss. Okay. So remember, and I'm going to calculate with your grade. I'm going to send you the email by individual.
Did you get
okay?
me, Mr. Patrick?
Kiana, yes, I get it.
Okay.
Yes. So I'm gonna send you the individual email to each of you guys. Okay, you're gonna see after I calculate with the ATI. So that's why you're gonna see so far your grade with your message and also your pharmacology. Okay. And also remember,
thank
if
you.
you do have some assignment you did not turn it in, so for example, like your ATI seminar, okay, you didn't do your post after the post ATI and post it, okay, and also with your syllabus, please access your syllabus both for the pharmacology and also your message. That's why I can give you the grade. All right, and also if you're missing some kind of like a quiz or some kind of like ATI exam, please make an appointment with the office and they can just give it to you and they will give me the grade immediately. That's why I can also update it. Okay, and also the makeup. Okay, if you need to do the makeup, also please submit as soon. All right, we are almost finished the message. Okay, you guys doing good.
Thank you.
Thank you. Good
Okay.
night.
Have a
Good
good night.
night.
Bye.
Thank you, Mr.
Bye.
Patrick. Have a good night.
You too. Bye.